Operating Officer of Aetna Better Health of Kentucky. We are honored to support the work being done by Kentucky Health Information Exchange. KHI's effort to connect providers and hospitals with secure access to essential patient health information from multiple sources will help improve care and clinical outcomes. This is especially true for patients living in rural areas or those physically challenged to leave their homes. When the COVID-19 pandemic hit, Aetna Better Health of Kentucky quickly mobilized our resources to help provide needed care for our members through telehealth services. Prior to the pandemic, the use of telehealth was limited. Since then, we have seen how helpful this tool can be to improve access to care, maintain provider-patient relationships, and offer safe and effective care from a distance. Moving forward, we anticipate continued use and development of telehealth to meet critical needs of the patients we all serve. It is my honor to introduce Division of Telehealth Services Director Donna Vino to you today, who will be sharing more on Kentucky's actions to enhance telehealth during the pandemic and how we should plan to regulate telehealth post-pandemic. Thank you so much for your tireless commitment to protecting the health of all Kentuckians and for your partnership to help improve care for the Commonwealth. Please join me in welcoming Donna and have a wonderful conference.
Good afternoon. I hope everybody's having a great time at the eHealth Summit today. It's a lot to learn. Thank you, Paige, for the introduction. As she stated, I'm Donna Vino. I'm the director of the Division of Telehealth Services, Kentucky Telehealth Program. And this afternoon, I'm going to be discussing with you the legislative and regulatory approach that the state is taking to expand telehealth services throughout the Commonwealth. You will notice that on your screen you have a Q&A. If there are questions during the presentation, please type those questions in. We have time after the presentation. We'll try to answer those questions, or at least we can get back with you after the presentation. Okay, let's get started. You will be able to, at the end of this presentation, you'll be able to be aware of the expiration notices, legislation, especially House Bill 140. I'll do an overview of that. Regulation, we had an emergency regulation that was filed, and then Medicaid's regulation that they're working on right now. And then we're also going to be talking about requirements for the proper use and security of telehealth. So let's get started with the expiration notices. Most of you all know that the public health emergency has been extended numerous times. Right now, it is due to expire October the 17th, 2021. We do expect it to extend through the end of the year. At least we're hoping that. So Kentucky Medicaid follows the federal public health extension or emergency. So all flexibilities that they have, or any types of suspensions or waivers, they are addressed in the Medicaid telehealth fax document that I have provided a list on the, or I'm sorry, a link to that document on the screen in your PowerPoint presentation. They follow that public health emergency expiration date of October 17th. So as long as the public health emergency for the federal government is extended, then Medicaid's flexibilities, suspensions, and waivers will continue. I've had numerous calls and emails from individuals wanting to know, well, is telehealth still being covered and reimbursed? And it is, and I don't know where the confusion is. I don't know if it's at the provider side or if it's the fact that some providers may want to see their patients in person now, or exactly what it is, but telehealth can still be utilized, and it is still reimbursed for the covered services. I do want to address the state of emergency. There are various professional licensure boards that approved different flexibilities or suspensions during the pandemic, during the public health emergency. And their language that they put in the document said that it would, those particular flexibilities and suspensions would expire at the end of the Kentucky state of emergency. So you will need to contact your licensor board for information regarding the status of that. We don't know exactly where the Kentucky state of emergency stands right now. So we're just waiting to get information regarding that. I also wanted to talk about the Kentucky registration for emergency system for advanced registration volunteer health practitioner. It expired July 23rd, 2021. And you should have received a letter from CHFS Secretary Eric Friedlander notifying you of that expiration. What this means is if you had a temporary license during the pandemic, to be able to provide services to Kentucky patients, that license expired July 23rd. So you need to go back to the Kentucky Board of Medical Licensure if you're a doctor, go back to the Kentucky Board of Nursing if you're a nurse, and get your license, or be licensed in a state that is part of an interstate medical licensure compact. Now let's take a deep dive into House Bill 140, and I hope I don't bore you. I'll try to go as slow as I can. 140 allowed us to have a new definition for telehealth. We included digital health in that too, because as we move forward in advancing telehealth, we know there's going to be, remote patient monitoring. There's going to be a lot of the artificial intelligence, and who knows what else is out there. So this bill we put together, and it got filed and signed on March 22nd by Governor Andy Beshear. And like I said, it had a new definition. So let me try to read this definition to you very slowly. It means a mode of delivering healthcare services through the use of telecommunication technologies, including but not limited to synchronous and asynchronous technology, remote patient monitoring technology, and audio-only encounters by a healthcare provider to a patient or to another healthcare provider at a different location. So that is Kentucky's definition. Now, I'm not quite finished, but I wanted to stop at this point. Notice we've added audio only, that it was included. CMS found that audio only technology was among the most popular services during the pandemic, and it was estimated 1 in every 3 telehealth encounters were conducted by phone during this time. We found out in Kentucky that the phone was very beneficial to Medicaid or to behavioral health. So we wanted to include audio only in that definition and get the approval to use it. Now, what this does not include in the definition, what the definition does include that is not available to be used is electronic mail, text, chat, and facsimile, unless a state agency authorized or required to promulgate administrative regulations related to telehealth determines that healthcare services can be delivered via these modalities to enhance recipient health and well-being and meet all clinical and technology guidelines for recipient safety and appropriate delivery of services. It established also in House Bill 140, it established minimum requirements for the proper use of security of telehealth. And it included requirements for the confidentiality and data integrity, privacy and security, informed consent, privileging, credentialing, reimbursement, and technology. It established minimum requirements to prevent established minimum requirements to prevent waste, fraud, and abuse related to telehealth. One other thing that is not included in the definition is basic communication between a healthcare provider and a patient through appointment scheduling, appointment reminders, voicemails, or any similar communication intended to facilitate the actual provision of healthcare services, either in person or through telehealth. And it must be delivered over a communications connection that complies with HIPAA. So the Division of Telehealth Services is required to do a couple of things. One is that we're required to establish a glossary of telehealth terminology to provide standard definitions for all healthcare providers who deliver healthcare services via telehealth. So that's all providers, that's all agencies, state agencies that are authorized to promulgate administrative regulations relating to telehealth, and that's all payers. What we found in looking at the different telehealth laws throughout state government, throughout the LRC, is that there was many definitions of telehealth. And we all probably, if asked, what does telehealth mean? We all could come up with something a little variance from what other individuals have said. So we decided to put together this glossary and adopt these definitions so everybody would be standardized in their discussion and in their laws as they are either created or amended. House Bill 140 does not require a provider to be physically present with the recipient unless it is determined that it's medically necessary to perform those services in person. It does not require prior approval, medical review, or administrative clearance for telehealth that would not be required if the service were provided in person. So whatever is required in person is also required by telehealth, but it does not require all of this that I just mentioned in telehealth if it's not required in person. It does not require a provider to be employed by another provider or agency. I know one of our previous Medicaid telehealth regulations did specifically identify exactly what agencies or what disciplines could use telehealth. It does not require demonstration that it is necessary to provide services to a patient through telehealth, and restrict or deny coverage of telehealth based solely on communications technology or application used for the delivery, or prohibit the delivery of telehealth services. That's a mouthful. Medicaid participating practitioners and home health agencies are strongly encouraged to use audio-only encounters as a mode of delivering telehealth. And that's only when no other approved mode of delivering telehealth services is available. So we do encourage you to use it, but if you do not have video available to you, then you use audio. Telehealth providers, of course, shall be licensed in Kentucky or as allowed under the state standards and provisions of a recognized interstate compact in order for you to be reimbursed for telehealth. There's new language included for home health agencies and rural health clinics and federally qualified health centers and health center lookalikes. And I inadvertently left that out of the presentation. So I will go back, and after I present that part, I will go back and correct this PowerPoint and make sure that it's reposted with this information. This is the new language. Medicaid shall reimburse for covered telehealth services and consultations if a Medicaid participating practitioner, including those employed by a home health agency, to a Medicaid recipient or another Medicaid participating practitioner at a different physical location. Now, for rural health clinics, FQHCs, and FQHC lookalikes, there'll be a reimbursement for covered telehealth services and telehealth consultations, and that shall include an originating fee and the amount equal to that which is presented under 42 USC Section 1395M For Medicare participating providers, if the Medicare beneficiary who receives the service or telehealth consultation was physically located at that facility at the time of the service or consultation delivery, and the provider of the service or the consultation is not employed by that facility, those facilities. If a telehealth service or consultation provider is employed by the RHCs, FQHCs, or lookalikes, include a supplemental reimbursement paid by the Department of Medicaid Services in an amount equal to the difference between the actual reimbursement amount paid by the Medicaid MCO and the amount that would have been paid if reimbursement had been made directly by the department. So that all deals with Medicaid right now. So we're going to move on to the next slide. And we're going to talk about health plans. And it's the same exact definition for telehealth and digital health as one that I previously read to you. Section 9 and 10 in the House Bill 140 are the health plans. And in Section 10, health benefit plans issued or renewed on or after the effective date of this section, and the effective date of this section is January 1, 2022, shall reimburse for covered services provided to an insured person through telehealth, including telehealth services provided by a home health agency licensed under KRS Chapter 216. So this starts January 1st, 2022. Sorry, covered that. Okay. All telehealth services reimbursed must meet all clinical, technology, and medical coding guidelines for recipient safety and appropriate delivery of services established by the Department of Insurance or the provider's professional licensure board. It requires the provider to be licensed in Kentucky, the same as Medicaid, or is allowed under the standards and provisions of the recognized interstate compact in order to receive reimbursement for telehealth services. And again, they're going to reimburse the RHCs, FQHCs, and FQHC lookalikes for covered services provided by a provider employed by the RHC, FQHC, or FQHC lookalike, regardless of where the provider was physically located on the premises of the facility when the service was provided. A little bit different than Medicaid, just a hair. Okay, again, the health plans, the providers and home health agencies are strongly encouraged to use the audio-only encounters when no other approved mode is available. And again, Section 9 and 10 of House Bill 140 do not take effect until January 1st, 2022. Okay, we'll talk about regulations right now. The Division of Telehealth Services work closely with the Department of Medicaid Services on creating an emergency regulation 900 KAR 12:005E, telehealth terminology and requirements. I provided a link for you on the PowerPoint presentation. It has been filed. It is in effect as of July 28th, 2021. And when you file an emergency regulation, you also file an ordinary regulation because the emergency is approved and is law for, I want to say, it's months. I think it's eight or 9 months. And then the ordinary follows behind it. As I said before, it includes a telehealth terminology glossary to standardize definitions to be used by providers, state agencies with telehealth laws, and payers. It addresses areas of compliance, maintain confidentiality of patient medical information, maintain patient privacy and security in accordance with HIPAA, obtain patient informed consent, secure credentialing if required by a third party or insurer or other payer, obtain privileges by hospitals or facilities to admit and treat patients, utilize the appropriate CPT or HISPAS code and place of service code O2 to secure reimbursement for professional telehealth services. Now, we are going to have to talk a little bit about audio only because we want to know that when we see O2, it's telehealth, but we want to know whether it is done by video or audio. So we're going to have to talk with Medicaid about codes and modifiers and figure out how we can determine what's been done by video and what's been done by audio as we start to talk about analyzing some of our data moving forward. Utilize non-public facing technology products that are HIPAA compliant. As you very well know right now, the Office of Civil Rights allows you to, they don't fine you for not using, for using public facing, for using public facing platforms. So right now, you still can use those, but we know as well, I mean, we've been talking, we feel like that the Office of Civil Rights after the public health emergency is over will require everyone to use HIPAA compliant software or platforms, and that I think it would be, in my opinion, great if CMS would just come out and say, look, these are the ones that we have tested, and these are the ones that are certified, and you can pick which one you want out of this group. And I think they did that with the electronic medical or health records. So I think that would narrow it down a little bit more, but not enforce or not tell you exactly what you had to use. As appropriate for the service provider and recipient, utilize the following modalities of communication delivered over a secure communication connection that complies with HIPAA. Live or real-time audio and video synchronous telehealth technology. That's your straight telehealth. Asynchronous store and forward telehealth technology. That is your store and forward images, pictures, things like that. Maybe we get to the point where, we might be able one day to see the CT scans or the MRIs. Remote patient monitoring using wireless devices, wearable sensors, or implanted health monitors. I think I don't think I'm speaking out of turn. I go to the UK doctors, and they just upgraded their electronic medical record to Epic, my chart. And I believe as I was going through and looking at all the different options, I ran across how to connect your Apple Watch. So they would be able to, I don't know if I could uploads or how it does it, but automatically, or you upload. But so they would know, your steps, if you have any problems with your heart, with the ECG that's on here, or EKG that's on here, or your breathing. I think it captures your breathing and your sleep apnea, or your sleep well as well. So that starting to begin to link up wearable devices and sensors to the electronic medical records. One doctor told me that it would be fantastic to have just use one platform, to have a telehealth incorporated into the electronic medical records software. And so I think more and more of those vendors are starting to do that. I think it's sort of cumbersome to, have two different systems, and your you've got your electronic medical record, but then you've also got your remote patient monitoring platform, and you're pulling all that data up, and you probably, have to do another couple of sequences to get that pulled up into your electronic medical record, even if you might be able to, you might not. So I think having one platform would be great. Audio only telecommunication systems, or we added this, clinical text chat technology. One of the MCOs came to us and talked to us about, they had within their telehealth platform something called text chat, and that it was secure, encrypted end to end. And while they were in the electronic medical record, that they could actually use the text chat to talk to the patient, or text chat with the patient in a secure environment. So we added the clinical text chat technology, but it has to be utilized within a secure HIPAA compliant application or electronic health record system. And it needs to meet the scope of the provider's professional licensure and the scope of practice of the provider. So just because it's there, if, let's say, social workers, let's say the Board of Social Work says, well, I don't think, we're going to approve clinical text chat to be utilized. So if the board comes out with that decision, that the board is the one everyone has to follow. The provider's professional licensure and the scope of practice of the provider. Complying with the following, you have to comply with the following laws to prevent waste, fraud, and abuse. And right now, I would say during this year and a half, that one day you weren't doing telehealth, and the next day you had to do it to be able to continue to see your patients. People didn't know what to do. The patients didn't know what to do. So they slowly, some of them already had platforms and could go on, but a lot of people did. And so they used a lot of the audio only. But I think that there probably has been some abuse. I don't think it's intentional at all, but I think it's just, you don't know what you don't know. And you were forced into using a technology that you may knew nothing about, or maybe very little about. So from the Division of Telehealth Services standpoint, education is very, very important. We need to get you providers up to date and understanding what is required, how you use it, what does your scope of practice allow you to do, what level of nurse are you, what can you do, and also make sure that you know what the False Claims Act is, the anti-kickback statute is, the physician's self-referral is, because you've got to follow those. Okay, we're doing good on time. Okay. So we have another regulation that's being worked on right now. It's 907 KAR 3:170, the Medicaid Telehealth Administrative Regulation Amendment. It is being amended right now in draft format with Medicaid. Medicaid's working on it. It's actually their Medicaid telehealth reg. And what it's going to do is going to be amended to align with House Bill 140 requirements. And they have worked on several drafts right now. They are anticipating it would be filed before the end of the year. I've seen one draft, and basically, like I said, it follows pretty much those requirements of House Bill 140. So look to that coming out and being filed within the next, 4 months or so. Okay. Okay, the Division of Telehealth Services is going to, it's actually, we are in the process of developing requirements for the proper use and security of telehealth and establish minimum requirements to prevent waste, fraud, and abuse. and also to determine what type of guardrails and guidance is needed for you guys to know how to use audio only. You wouldn't want to call a patient and give them their test results and then bill for that, because it probably would be, maybe a 30-second conversation, if that. So I don't think you ever billed or got paid for that or reimbursed for that prior to the pandemic. So you wouldn't want to use the audio only like that right now. But we are discussing internally. We've got a group that met I think it was last week. We are discussing internally what type of guardrails and what type of guidance you all will need to know how to use audio only. And of course, we're also anticipating and patiently, or not, maybe not patiently, maybe anxiously awaiting for what is going to come out of CMS, Department of Health and Family Health, DHS, the Department of Health and Human Services. Yeah. So, like I said, we're all working on these things right now, trying to draft some stuff, and we'll hopefully have be able to come January know what if the public health emergency is not extended again. We will know hopefully by then what will be the actual laws or rules in place, policies in place. Okay. So here's my contact information. I do work in the office usually 2 days a week, but I work from home the other days. So the best way to get a hold of me is the cell phone number or through my email. A couple of things that are extra before I get off is I just want to give you a little overview of what our division does for those that don't know. We are here to be a resource to you. If you need education, we're putting together an education matrix right now based on your discipline of the types of courses you might need to be able to do a telehealth encounter. And a lot of people say, well, that's easy. It's just looking at each other over video on the screen. But, there's other things too. There's things like, you need to pay attention to the screen, and you need to have your electronic medical record, at a place to where you're not just looking down and typing all the time in it. You need to have eye-to-eye contact with your patient. So the different education that we're looking at, we're not going to provide the education, but we will provide you with certification programs and where they're provided, some free things that are available to you, and also some that aren't. We've got a boatload of information that we've come across already. We have a website, telehealth.ky.gov. It is in the process of being revamped. It will have two ways to get into it. One will be from a patient's view, and the other will be from a provider's view. And we are pursuing looking at a provider database that would identify the types of providers that are providing telehealth and what type of services they are providing and where they're located, what county. And so we also are working very closely with the Matrix group in looking at a telehealth locator service, and they're wanting to take it that I just talked about, and they're wanting to combine various states. So let's say you wanted an expert in cardiology specific to a certain part of your heart. You could go out to that telehealth locator service, even if that person was in another state. You could reach out to them if they provide telehealth. But now you've got to follow all your policies and reimbursement, billing, and all that as well. So let's see. Another thing that the Division of Telehealth Services does is we have 10 different work groups, and those work groups have been in place for probably about a year now, and or maybe a little bit longer for some of them. And we are looking at everything. We're looking at school-based telehealth, privacy and security. We're looking at how the local health departments how they should play with telehealth. We have talked over the last year about a strategic direction for them, working very closely with Dr. Connie White and their group. And we would love to see the health departments be community hubs, one in each of the counties, that the patients in the community could, instead of traveling to see their specialist, could go to the health department and then connect through telehealth to their specialist. So that's our strategic direction for health departments. We're also working with looking at grants, available grants. Of course, there's a limited number of staff to be able to respond to those grants and see if we could get some money. And then if we got money, you got to implement. So hopefully in the future, we'll get some more staff as we move along. Other thing we're looking at is security, looking at the need for business associate agreements to make sure that you are covered as a provider, that your vendor says that it is HIPAA compliant, and that that everything is taken care of. Don't assume. Do not ever assume when your telehealth vendor tells you that, oh, my platform is compliant. You make them show you. You make them show you the security on it. Things may need to be turned on. I asked the question of the folks at Commonwealth Office of Technology. I asked the question when they implemented Microsoft Teams. We started playing around with it, trying to figure everything out. And I said, is this secure? Is it end-to-end encryption? Oh, yeah. Well, as I started doing more research, I started pulling documents down saying, oh, yeah, it's secure, but only if you turn the security on. So I've got to get back with them to see if they've got everything turned on there, because it is needed. So don't assume that your telehealth vendors say that their product is compliant, because it's hard to really make a piece of technology HIPAA compliant. It's more around the processes that you do as a practitioner that are compliance, that have to be compliancy. So other things that the work group is doing is metrics. We just started a couple of weeks ago. We are looking at, okay, now that we are using telehealth, what kind of measures do we need? What type of outcomes? How do we measure? What do we collect? We do know that a lot of the insurance companies code differently than we code. So we have the MCOs at the table on our work group, and we'll talk to them. And we've got Department of Insurance that we've been meeting with very closely to make sure that we talk about, is there a way that we can standardize some of this? I know that it's different for Medicaid and Medicare, but then it's different for Medicaid in every state. You can't find two states that are the same. It's all different. So hopefully we can put together some resource materials for you as we move forward to advance telehealth in the Commonwealth. And anytime that you'd have a question, please do not hesitate to email me or call me. I get a lot of spam on my state phone. So if I happen to not answer, just please leave a message and I will call you back. Okay, that's all I have right now. And we've got about five or 10 minutes, looks like. Let's see what the first question is here. Okay. The previous telehealth laws said the same things, but excluded self-insured and state employee plans. Does the new law have the same exclusions as the previous laws? And the rates must still have parity? Yes. The Department of Insurance, the Department of Personnel has our insurance for state government employees. And the way that is right now is if you use their, I think it's called Live Health Online. If you use that, there is no cost associated with it. But if you decide to go to your provider see your provider and use telehealth, like I did with UK last month, I have to pay a copay. So the copays were, we didn't have to pay those until I think it was last September. Anyway, you have to pay the copay just like you would if you saw your provider in person. I mean, there's no difference, but at first they were excluded. Now for, okay, let's see, self-insured. Yeah, that would be us. And that I know UK is the same way. UK's employees, if you use Live Health online, there's not a cost associated with it. But if you use a provider, then you do pay your copay, just as you would if you saw the provider in person. And as far as the parity rates, we are a parity state. However, there is additional language that says that providers and insurance companies can negotiate with the providers a lower rate for telehealth services. So when you're working on your contract providers with your insurance companies, they may say, we're not going to pay what we pay you for an in-person. So let's negotiate a lower rate for telehealth. That's just between you and the insurance company. So I don't know, we can't do anything about that. Now, the department pays parity, Department of Medicaid pays parity. So if whatever it's in person, it will be the same amount for telehealth. Very few, she says, yeah, very few of us have the ability to negotiate. So they just come out and say, this is it. This is what we'll pay. Is that what you're saying? Okay. Are there any other questions? We're getting close to time. Okay. Well, I've enjoyed today. I hope that you're able to understand a little bit about what I went over. I know it's dry, laws, regulations, and legislation is dry, but maybe you know a little bit more than what you did when you came to the session. I appreciate you taking time to participate. And like I said before, anytime I can help you, please reach out to me either by cell phone or email. And thank you so much. Appreciate it.
Donna, we'd like to thank you for this session. It has been very informative. And everyone, we wanted to invite you. You'll have a few extra minutes to visit the exhibit booths. And then be sure to join us for our afternoon sessions that start at 2:30. And then the summit will close at 3:30, and we will be announcing the prize winners. So Donna, again, very informative. Thank you. Thanks,
Thank you.
everyone.
Appreciate it. Bye-bye.